Hi, I am Dr. Manjusha Patil. I am an emergency medicine physician. Now, before we come down to CPR guidelines, let us understand what exactly is CPR. CPR stands for cardiopulmonary resuscitation. When we do a cardiopulmonary resuscitation is in scenario of cardiorespiratory arrest. What exactly is this? Any patient who is unresponsive or a patient who is not breathing or a patient who is gasping. Now, gasping is abnormal breathing. It is very important for our patients or as lay rescuers to understand these indications before we get down to CPR. When you talk about CPR, the most important thing, if you understand or recognize a patient as being unresponsive or fallen to the ground, what you do? First thing, check for the scene safety for yourself. Once you've done that, call up the emergency services. While in India, we call up 108. Once that is done, you immediately rush to the patient and check if there is any breathing or not. Once you've confirmed there is no breathing, you start with what we call as chest compressions. How do we go about with chest compressions? We keep both the hands as wrist interlocked over the patient's chest at the level of the nipple. We go above the patient, hands locked, and start giving chest compressions. This chest compressions goes in the manner of at least 100 to 120 compressions per minute. We go in the depth of 2 inches or 5 centimeters and not more than that. Once we push hard, we also allow the chest to recoil back. Now that gives a scenario of a good chest compression. We keep continuing the chest compressions for at least 2 minutes or till the time the lay rescuer is tired. Meanwhile, we also expect somebody else to help you with the chest compressions or the emergency services to arrive. Once these emergency services arrive, we put the patient in something called as defibrillator, and further the patient is shifted to the tertiary care center. So these were the guidelines of CPR in a gist. Thank you.